Okay, well, we've got a good group here and it's a little after 6:30, so I guess we'll get started. I'd like to welcome everybody to the January meeting of the Capitol Hill Neighborhood Council. And this is our regular monthly meeting. This month it was postponed by a week, so we wouldn't conflict with the inauguration and any festivities that might coincide with it. But our normal meeting is the third Wednesday of every month at 6:30. You all obviously know how to register, but if you know anybody else who would like to attend, and we would like everybody to attend, all you need to do is go to our website, which is www.chnc-slc.org, and sign up for our email list, and then you will automatically get a notification about our upcoming meetings. So we are eager to have as many members of the community join us at these meetings as possible. We hope to provide useful information for everybody. We have with us today, oh my goodness, somebody just shared their screen of what looks like a wonderful place to ski. Who's doing that?
I somehow did it, and I was just trying to see there. Thank you. I don't know how on earth that happened. It went to Brian's screen. I was just trying to scroll to see who was there. Sorry.
All right, that's fine. Oh, I don't mind looking at pictures of snowy mountains. Okay, so another thing I would like to announce is we have a new board, and many of them are on this call. And we have formed a number of committees that include transportation, infrastructure and planning, which deals with all of the notifications we get from the city regarding new development or new planning initiatives like zoning that are being proposed for our neighborhood. We have an events and programming committee that takes care of things like what happens on these meetings, and also our major events during the year, which are Jam Fest, which I'm sure many of you are familiar with, which happens in October. And we have had, until the COVID pandemic, a 4th of July breakfast, a free breakfast at Warm Springs Park. So the Events and Program Committee takes care of that kind of stuff. We also have a Communications and Diversity Committee, which takes care of social media, the website, and generally trying to engage the community to a greater extent in our group. So if anybody on the call is interested in any of that stuff, please type your name and a contact, whether a phone number or an email, into the chat box, and I promise, get back to you.
Hey, David.
Yes, Barb.
I know that the Jam Fest committee, which is kind of separate, but they really don't have a committee right now.
I was thinking
there's only Jack and Nick.
Well, I was thinking they could be under the umbrella of the events and programming committee. I don't think it really requires. I mean, Jack and Nick will obviously still lead Jam Fest, but if to the extent they need to communicate with the board and the rest of the community, they can do it through that committee.
I was just thinking that anybody that wants to join, that's one committee that doesn't have anybody right now that needs people.
Well, we actually don't have a Jam Fest committee officially anymore. So
can we make the Jam Fest committee members of the planning and events committee? That would be phenomenal for me.
Well, yeah. I mean,
I'd love that.
By default, they are. You may not. Well, I don't want to go into it too much in depth with everybody here, but we'll talk about it offline. Okay. So we always have a number of public officials who join us. Normally, this would include the police department, but we have Bob Norgard, who is our new liaison for District 3 with us, and we've given him an entirely separate slot tonight so he can introduce himself and the various initiatives that the police department is undertaking on our behalf. So we'll let him wait until later on, and I'll start with Chris Wharton.
Hello, everybody. Happy New Year. So we elected new leadership for the City Council, which is what we do every year in July. That the new leadership for this year will be Amy Fowler from District 7 as the chair and James Rogers from District 1 as the vice chair. And I'm glad to be having a year out of leadership. I've served in leadership the last 3 years, and so it'll be good to not have to have that extra responsibility this year. The council will have a retreat probably in the next month where we will come together and share our priorities for each of our districts, and then try to find as many main priorities that we can have the most number of council members agree on to try to work through for the year. But some of the things that I know we're going to be working on are housing initiatives, continuing to address the ongoing problem with unsheltered and homeless individuals. But then there's also going to be some major proposals coming from the administration about increasing affordable housing by doing more infill in mostly in the central city neighborhood. So that's going to include pretty big either zoning changes or changes to the text, like text amendments to existing zoning. So you'll definitely want to keep an eye out for those. The council will continue to look at our police reforms, and also the council made a
Who's
decision
Gordon
to.
Wilson?
So the council will make an effort to also increase recruitment. We had previously had a hiring freeze in place for all parts of the city, including the police department, because of the pandemic, and we weren't sure how that was going to affect the city budget. The council did lift the hiring freeze so that we can start hiring some more officers to fill those that to fill the vacancies that we have in the department. We'll also be looking at, how we can continue to diversify our police force and how we can recruit the best officers that we have in Utah and around the state so that they want to come and work for Salt Lake City. Also, two major priorities that I'll have for our district are continuing to address the traffic and transportation issues. Right now, I've been doing the meetings monthly or sometimes every other week with the transportation committee. We met with UDOT and with UTA to talk about changes on overlapping jurisdictional issues. Also, there is, we talked before about in that committee and in this group about loud modified exhausts on cars. There's a potential to, right now in the legislature, there's a bill being put forward to address street racing, which is an issue in across the state. And we're trying to see if our city lobbyists can add in being able to regulate modifying exhaust to that ordinance, so that, to that bill. So that would be a statewide thing, and then we wouldn't have to divert resources in Salt Lake City to do the ordinance, because we'd have a statewide bill. So our efforts have kind of shifted from the city ordinance to the statewide bill to see if we can make that change. If not, then we'll shift back to trying to change the local ordinance. And then also, I'm hoping now that if we can get through 2021 with fewer natural disasters and emergencies than we had in 2020, then I hope we will make some progress on the Marmalade historic street signs. We do have a new person that's the director of community and neighborhoods that has a very different and much more positive attitude towards this effort. And I think that had it not been for all of the crazy things that happened in 2020, we probably would have been able to get this done, but those were delayed. But it's still a priority for me to try and get that taken care of this year. Does anyone have any questions?
Yes, I've got a question. This is Gordon Wilson here. On the hiring of police officers, when we met with the police in August, they mentioned that the police force had diminished by 10% from May 30th to, I think it was mid-August, and that you weren't able to hire enough police fast enough. I'm questioning the logic of not hiring during COVID. Isn't there a way, I mean, everywhere else tests before you go into any significant facility to see if people have symptoms or if they're COVID positive. Why is there a hiring freeze when we're so desperate to hire more police? That's my question.
Yeah, so a hiring freeze was put in place as part of the city budget, which was in June and end of June and began in July. And that was because so much of the city's revenue that we use to pay for police comes from sales tax. And with the pandemic and the shutdown that happened in the spring, we weren't sure how much revenue we were going to have for all city operations, so what the impact was going to be. And so
I understand that, except that if police were quitting after May 30th, it seems like you'd still have that budget in place, right? For the police to replace the ones who are quitting. If 10% of your force quit, seems like you'd still have that budget at least to hire new, right? Or no?
Yes, you would. But at that point, the amount of police that were leaving was comparable to other years. And so we didn't think that it was going to have a negative impact on the overall police force. And that came more later in the summer. And you can't, when we hire, before the council replaced the Civil Service Commission, which we did in December, if we hire a lateral officer from another department, they come in as a brand new officer. So it makes a lot more sense and is more economical for the city when we do a hire is to hire a whole class of officers as opposed to just pick and hire one officer here and there. So the administration had to come to us to ask us to lift the hiring freeze in order to hire a whole new class. And now that we've gotten rid of the Civil Service Commission and replaced that with a new model, it makes it so that we can hire officers and they can transfer laterally into the department.
And so where are we now? Do we have our full complement of police or no?
So that we have a class of officers that's just finishing their training, and they will now that so it also takes a long time to train officers. Like it takes several months to train them. So
let me ask you this: when we get this new class, that's great. Will we have as many police officers this year as last year? More police officers or fewer?
We'll have the same amount. The lifting of the freeze allows the department to rehire for any losses that we had since last year. So we'll have the same amount that we have.
Thank you so much.
Yep.
Hey, Chris, can I just ask a real quick follow-up question there? It sounds like you used lapsed FTE dollars to balance last year's budget due to revenue. Are you planning to use any lapsed FTEs to balance this year's fiscal budget, or is that completely off the table?
Chris, please translate FTEs before
Yeah,
you.
it's a full-time employee. So what they're doing is they're using lapsed dollars on payroll to balance the city budget because it's like bonus cash. So I'm just curious, if you use that as a tactic for 2019 or 2020, are you going to use that in 2021?
Just for the police or for the whole city?
Just for the police, for public safety.
So police, there's an audit going on right now of the police budget that will do a zero-based budgeting exercise. And so this year, the policing budget will be different. The procedure for reviewing it will be different than in previous years. But use of FTE savings is potentially on the table. All options are on the table with the zero-based budget. But we're hoping that this year's police budgeting is going to be a lot more in-depth than it has in previous years, so that we can give that accountability and that visibility to the public that they've been demanding for the last year or more.
Yeah, because it sounds like right there that we may not be getting our full complement of officers because you're holding some FTEs back. Is that a correct summation there?
No, so the budget that we had so the mayor proposed a flat budget for 2021,
Okay.
which was no increases in like no new FTEs. But we had some FTE savings previously. The department used some of that money to recruit and to get this new class of officers. The council lift the hiring freeze, so it will backfill all of the officers that we've left since, or we've lost since 2020. And then the council, through the budget-based exercise, will decide whether or not we need to allocate more for 2021 hires, or sorry, for prospectively for the rest of 2021 and for 2022. Does that make sense?
Yep. Thanks, Chris.
Yep, you're welcome.
Any other questions for Chris?
I have a real quick one. And going back to the noise ordinance that you're talking about, I'd love to see a component of it enforced by, I don't know if the housing authority would be right or what, but those that have renters, like your apartment complexes and things like that. We see a lot of that kind of traffic coming from there. If they could have some sort of component in their lease that would make it the same as noise within the building itself, because it's most of the time they're parking on the premises of where the apartment or the residence is. I'd love to see some part of it go towards that as well, and allow them to report. And that in turn would benefit for them. They'd be able to enforce it and potentially cancel a lease if they don't uphold it. So that was it.
That's, yeah, I've never thought of that or heard that suggestion before, so I will look into it.
Thank you.
Mhm.
Okay. Anything else for Chris? Thank you very much. It's always a pleasure to have you.
Yeah, pleasure to be here.
Okay, let's see. I'm looking around my rogues gallery here. I see Catherine Kennedy from the school district. Hi, Catherine. Don't forget to unmute.
Hey. Hi, everyone. I don't know if you can give me screen sharing capability, but if you can, I'll put something up. If you can't, then that's fine.
I think you can do it, Catherine. Try. Go ahead. It says all participants can do it.
I'll do it in just a second. Then that's great. So,
Okay.
So I just wanted to give you a quick update on what's happening in the Salt Lake City School District. And thank you for attending this meeting, and thanks for what Chris is doing to responsibly handle the police. I really appreciate it. On January 5th, since our last meeting, the Salt Lake City School Board voted to return to school after our secondary teachers, for secondary students, after our secondary teachers were fully vaccinated. We had previously voted to return to school for elementary students on this past Monday. On January 19th, the school board reversed that vote and voted to return to school on February 8th, which is the date mandated by the legislature. You may have seen news about that. Many people thought, I think accurately, that the legislature bullied us into that decision. I actually voted against that decision. I want to step aside though and say that our own legislators are enormously supportive, and I appreciate their support. Jan Daly Provo, Derek Kitchen, the other legislators that represent Salt Lake City, with the exception of Todd Weiler, have been really supportive. Todd Weiler did put a bill on the first day of the Senate, Senate Bill 107, that said that if we didn't return by February 8th, we would be in danger of having the legislature allocate our funding to private schools if students chose to go to private schools at up to 3 times the amount of the WPU, which stands for weighted pupil unit, which is the amount of money that they give us for each child. So they said that they would take the finances, the money for that child, and up to 2 more if, depending on the price of that tuition. So for example, if that child had gone to Roland Hall, they would have taken that full amount. So I think that our other school board members saw that as a legitimate threat, and they voted to go back to on February 8th. So our secondary schools will be starting on February 8th. We've heard a lot nationwide about the fact that it's safe to return to school. I don't think that applies in Utah, and I'll show you the data why. And the reasons why I think is that that most of the studies that they're doing are in communities where the positivity rate is less than 10%. So one of the big studies they had is in North Carolina. During the months that they were doing those studies, the positivity was at 6 and 7%. And it also doesn't apply when your community includes a large number of anti-maskers or COVID deniers. And it also doesn't apply when you have the size of classrooms and students in classrooms that we have. So those are three of the things that I think make us exceptions. And now I'll see if I can share my screen. This is data from the Salt Lake County Health Department. You may have already looked at it. Let's see.
We're not seeing it just yet.
Let's see if I can get it there. There we go. Can you see that?
No. Oh, yep, here we go. Yep.
Great. So now let me just move you over. There we go. So as you can see from this data, this is the most recent data from the COVID-19 dashboard at the Salt Lake County. They have a lot of charts that are very interesting to flip through. This is like the 13th page, and I took a screenshot of it so it'd be easy to share. The blue, the light blue, if you can see right here on Salt Lake, is the total number of cases we've had since school started. The dark blue is the number of cases people have had in the last 2 weeks. So as you can see, Salt Lake City School District is the lowest of any of the categories. So I'll actually try to make it even bigger if I can. And so you can see that we are lower than Murray. Murray has about a quarter of the schools we have. If you don't count our charter schools, which do count in our numbers, actually, we have 38 schools, and Murray has a total of 10. So if you look at our charter schools, they are actually a quarter of our size, and still we're below Murray. We're also significantly below the charter schools, and we're below the private schools as well, even though they have a lot of mitigation strategies that we are not able to apply. So this, I think, shows really clearly that what we've done by being remote in Salt Lake City School District has been effective. You could see this chart all through the last 4 months since school started, and it has always looked like this. So our remote learning did make a difference, and it didn't only make a difference in the schools, but as I'm sure you recognize, and I'm going to stop screen sharing now. As you recognize, when we stop cases at the school level, they don't go home, they don't get passed to parents, they don't get passed to grandparents, they don't get passed to friends. So we have stopped COVID spread in our community, and I think that's really significant. We've kept people working, we've kept work days going, we've kept hospital beds open for the surrounding school districts, for the hospitals inside Salt Lake City. And we have done, I think we've really done something, and I'm proud of what we've done. So I think that you can see very clearly from this data that that remote learning has been really effective for us. And if other districts had done it, then they would also be, we would all be in better shape. The other districts that were up there, just put it up really fast again. The other districts that were up there are larger than our district, but we're still proportionally less than the other districts. There we go. And so we have, I think Canyons has 33,000 students. So we're still less than, we have about 21,000 students. So we're far less than 2/3 of Canyons. So there's Canyons. Granite has 67,000 students, and we are still less than 1/3 of what they have. And Jordan actually only has 55,000, I think, students. And but Jordan, as you know, encompasses, unlike Canyons, Jordan is the other half of Canyons that sits on the west side of Salt Lake City. So Canyons mostly sits on the east side, and Jordan mostly sits on the west side. So they do have more cases in Jordan, and you can see how much we have it. Granite and Salt Lake have a split between east side and west side schools, unlike Canyons and Jordan. So I do think that the data is really convincing that, like I said, that what we've done has been really, really positive. So I don't think I shared that till right now, but here it is. So we have Canyons, Canyons with 33,000, Granite with 67,000, Jordan with 55,000. And then Murray actually has, like I said, I can't remember the number of students, but it has 10 schools we have, depending on how you count them, either 38 or 43 schools. And then you have the charters and the privates. So that's just some actual data for you to take a look at as you're thinking about these things. And the data isn't regularly talked about. So I am concerned about our teachers as we go back, and our students. Our teachers will not be fully vaccinated for at least 8 weeks. We have about half of them vaccinated right now. And we are getting only 300 doses or vaccination doses a week right now. We started with 800, and that made a huge difference. And then when we have had since then or as of tomorrow, we'll have 2 more 300 doses. So as of tomorrow, I think we'll probably cover about half of our employees. And so we will need another 5 or so weeks to get the rest of the teachers vaccinated. And that doesn't count our students. And I think that probably COVID passes more readily among the student population than the teacher population, but the teacher population is much more at risk. So I am really concerned about that as we go back, and I'm going to be watching those numbers really carefully. So we have some other things happening. We are hiring a new superintendent. That's going well. We have a bunch of applications that we're actually reviewing tomorrow night. So for the first round, I'm happy to take any input from any of you. If you have any comments about superintendents and superintendent hiring, we will try to do the best job we can, of course. Besides that, regular things are going on and things are progressing. And I do think that students many of them are glad to be back at school. I do think that ultimately being back in school is our goal. I think that it's important for students to have the opportunity to be in classrooms. We've tried to mitigate somewhat by having small groups meeting at school. And we've always had our special ed students at school, and also some of our multi-language learners, MLL students. That is the new term for English language learners. I've been told by people in the profession that we now are calling English language learners multi-language learners. So does anyone have any questions?
I apologize, but we're going to have to move along to Nicholas Rupp. We promised him that he could go from 7 o'clock to 7:30. He has a busy schedule, and so we have to honor that commitment to him.
Right.
Afterwards, hopefully we'll have some time for questions for you,
Right.
Catherine, and also to hear from Jen and Todd. Hi, Todd.
David, can I pipe in for a second? If anyone has questions for Catherine, they can use the chat too, right?
Good.
Absolutely.
Yeah. Good. Okay. Mr. Rupp, Nicholas Rupp.
Hello.
You're there. Hi.
Thank you so much for having me. I love Capitol Hill. I lived there in college, and it's special to me because of how diverse and eclectic it is. So congratulations on having a wonderful neighborhood and community. So the first thing that I was asked to speak on is the current state of COVID in Salt Lake County. We do have fewer cases than we saw in our surges previously this year. Today, we only have 7,913 cases. I say only, like that's not very many. Unfortunately, that's still quite a lot, but it's fewer than we have had in the past. I'm going to share my screen here, and you are already familiar with this, I think, because your previous presenter was using it as well. You can see here our trend line. We are trending downward the last pretty much 2 weeks. And so that's hopeful. We're optimistic. Testing is also down, however. So some of that may be correlated to fewer tests, but we are not seeing increased hospitalization like we were previously. So we think that fewer cases are potentially circulating in the community. We're going to watch this closely and see if it continues to go back up. Personally, anecdotally, I think that the surge post-holiday, whether it was Halloween, Thanksgiving, or the winter holidays like Hanukkah, Christmas, and Kwanzaa, that we have tapered off past those family gatherings, people getting together. And because we're comfortable with our family members, our extended family, we are likely to be less vigilant in wearing our face coverings in those settings. Now that we're more in the doldrums of winter. I like to call them. It's not a super exciting time here in late January, except for those of us who are fans of the legislature, of course. We're less likely to be socializing with our friends and family than we are during the holidays. So I think that a lot of this is people following those recommendations better than they were previous during the holiday season. Does anybody have any questions specific to COVID cases, or should we move on to vaccine? I know that was a big portion of this, is interest in the vaccination process, and I had some questions submitted. Do we want to just start with those? Would that be okay?
Yeah, sure, go ahead.
Okay, so let me pull those up. The first question we got was, it's been reported COVID can attack multiple organs and systems in the body, to include brain, kidneys, and the heart. Will the vaccine be effective in helping the body fight the virus if someone still has active COVID but may be asymptomatic? So I am not an MD, so I asked Dr. Vitek, our medical director, this question, and I'm going to grab her answer and read it to you. All right, Dr. Vitek says, we know that the virus can cause some chronic damage to organs. We don't know at this time if it's permanent or just long-term. My understanding is that most of the damage is expected to heal in time. The vaccine would not help with that repair. It does help the body form antibodies, which means it prevents COVID, or if the person gets infected, it decreases the severity, therefore decreasing the chance of organ damage. Our next question, will people only be able to receive the vaccine in the county in which they live? We are asking people to go to their home county to receive the vaccine. When we vaccinate healthcare workers, Salt Lake County Health Department chose to vaccinate anybody who lives or works in Salt Lake County. We thought it was important that people who live in other surrounding counties but work here in Salt Lake County with individuals who live here, that they be protected. So we vaccinated healthcare workers who either live or work in Salt Lake County. But now as we transition into people 70 and older who are being vaccinated, we are asking that people get vaccinated in their home county. Next question, can someone who has a primary residence in Washington County make an appointment in Salt Lake County and travel to Salt Lake City for the shot? As long as you have documentation of being a resident of Salt Lake County, even if it's part-time, there should be no problems if you are here in Salt Lake County during the time that you are eligible for vaccine. So if you're 70 or older, you're eligible right now. If you're in Washington County at your home there, you should be vaccinated there in this time. If you're in Salt Lake County right now and eligible, you should be vaccinated here. Now, as we expand those priority groups, as Governor Cox adds priority groups and we get younger people eligible for the vaccine, people with underlying health conditions eligible for the vaccine. We're going to ask people that when they're eligible, they go to their home county, wherever they are at that time, if they have homes in multiple counties. The next question, when will my age group be able to get the vaccination? Also, do we know more about how the virus is really spread? For example, something we touch. Let's do the first part of that question. When will my age group be able to get the vaccination? That's a difficult question to answer. A lot of that is going to depend on how much vaccine we get from the federal government, passed to the state, and then distributed to the counties in Utah. We have been told by the Utah Department of Health to expect that people 65 and older may become eligible by late February or early March. Of course, a lot of this changes every day depending on vaccine availability and how the vaccine process is going here locally in the state and in the county. But we're hopeful that 65 plus will be in March, and then we'll decrease from there. Perhaps younger people who have underlying health conditions, they could be included in late March or in April, but this is again all variable depending on a lot of factors, but that's our best guess at this time.
Cool.
All right, our next question.
Could I remind everybody to
Can
mute
I hang out
themselves, except for
outside
Nicholas,
if there's
please.
excess?
Rhonda, would you mute
Yeah.
yourself, please?
Whoops.
Thank you. Sorry, Nick, go ahead.
No problem. I completely understand. We're in a Zoom world now, right? That happens all the time. Next question. My wife and I are over 70 and we've received or scheduled our vaccinations. When complete, I'm wondering what behavioral changes we might make. Can we now dine inside at a restaurant, go to movies, and invite others to socialize in our home with us? All things we obviously miss. Boy, when I read this question, I felt it personally. I love to socialize and patronize our restaurants and our entertainment venues, and I've missed it so much. What the CDC is telling us is that even after vaccination, until we have herd immunity in our community, which is estimated to be 70 to 80% of vaccine coverage, according to Dr. Fauci, in the community, we need to continue taking precautions, but that doesn't mean we can't engage in those activities. I know when I get fully vaccinated, it'll be 2 weeks after the second dose when my body is fully prepared to fight coronavirus as much as it's going to be. It can take 2 weeks after that second dose for your body's defenses to fully build up and prepare to fight the virus. So when I'm able, 2 weeks after that second dose, I will continue wearing my face covering. I will continue social distancing, but I will tell you, I will probably patronize more establishments. I've been ordering takeout like crazy. Pretty much 1 meal a day I order takeout and support our local businesses. And I'm going to continue to do that, but I will also dine in more at that point because I do feel I have a little more protection once I have that vaccine. But it will be essential that I continue wearing a face covering and practicing social distancing as much as possible until we get the word from the Utah Department of Health that our community as a whole has reached that herd immunity level. Next question is, will we still have to adhere to the mask mandate if we had our vaccine? How can we be identified as having it so we'll be exempt from the mandate? How can we prevent false vaccine documentation? Is there a database the public can use to verify if someone is vaccinated? So I think I answered part of that in my last answer. We're all going to be masking still to be responsible citizens, even after we're vaccinated, until we are told that we've reached that herd immunity for this community. We do not have a database of people who are vaccinated. It's your private personal medical record. It is protected health information. HIPAA and other medical privacy laws apply. In Utah, in addition to HIPAA, we have the Communicable Disease Control Act that protects individuals' privacy if they've been diagnosed with a disease, and that includes vaccinations and other public health matters related to preventing the spread of disease. So it's all very private and very protected. So no database, no marker on people if they've been vaccinated or not, which is why it's especially important we all continue to take those precautions that the scientists and doctors tell us are so important, even after vaccination. Next question is, when can our children receive the vaccine? Have trials begun for children? And what is the anticipated vaccine schedule for children? What age groups will be tested first? And I asked Dr. Stevenson, Audrey Stevenson, who is our vaccine expert, that question, because I wanted to make sure to get it right. And she says, vaccines we have now are approved for over 16 for Pfizer and over 18 for Moderna. So 16 and up and 18 and up, depending on the brand of vaccine. Phase 3 trials for children who are over 12 have begun, but there's not a timeline because those phase 3 trials, they only stop when the manufacturers believe they have enough data to submit to the FDA. So depending on what their findings are, that time period can expand or contract based on the data. They're not going to submit, and the FDA is not going to approve if the data doesn't indicate that this is a safe, effective vaccine for children 12 and older. Younger age groups will probably start after a successful phase 3 trial for 12 and older. They'll move younger and younger, but there's really not a timeline for that yet. At one point, I heard it theorized that 12 and up may be eligible for vaccine in fall 2021. I don't want to, stake my hat on that. I don't want to say that's going to happen. It really will depend a lot on how those trials go. What else does she say? We don't have any recommendations for children at this point. She personally guesses that children with underlying medical conditions may be eligible first, but that is just her personal guess. And that could include diseases like asthma or other immunocompromised issues. All right, my next question received is, how long after the second dose is a person considered protected from COVID-19? And how long does this protection last? How soon will we need a next dose, or doses after the first 2? Will we need 1 or 2 booster vaccines? Is there a possibility of a lifetime vaccine? Very good questions. And unfortunately, the answer for a lot of that is we don't know yet. We don't know how long immunity from the vaccine will last in our bodies. We don't even know how long for sure immunity from catching the disease is going to last in our bodies. There are theories that it could last, a number of months, a number of years, or potentially a lifetime, but no one has determined definitively. We haven't had time to do studies on that to see how long that immunity might last. So there is potential at this point that the COVID vaccine, if immunity only lasts a year or less, it could be something that medical professionals recommend we get every year, like a seasonal flu vaccine. Alternately, studies may find over time as we research people who have COVID and who've been vaccinated against COVID, that our immunity lasts longer than that year, and you don't need a yearly vaccine for COVID. Perhaps it will stretch out to 5 to 10 years like we have for Tdap, for tetanus, diphtheria, and pertussis. Perhaps it'll be even longer, and lifetime immunity could be conferred. We just don't know yet because we've only been studying this illness for about a year in the entire world. So it's going to take some more research to determine how long that immunity might last. And then the last question I received is there a higher danger of negative effects from the vaccine if you have an autoimmune disorder and get the vaccine? How would the vaccine react to patients with asthma? Are there any complications reported for asthmatics or people who have severe allergies, including seasonal allergies? Are they more at risk? I wanted to ask Dr. Vitek, our medical director, this question as well. And she said, no, there's not a higher degree of negative effects from the vaccine if you have an autoimmune disorder or asthma. The vaccine has the same side effects for everyone you listed and everyone else. Even for people with allergies to food, pollen, like seasonal allergies, etc., they should not be affected by this vaccine inordinately. The only people who need to be concerned about the vaccine is someone who has previously had an anaphylactic reaction to any vaccine. So if you've had an allergy or a reaction to a vaccine, then you are someone who will want to talk to your personal physician, your healthcare provider, about if the vaccine is right for you. But everyone else, it is not contraindicated unless you've had a previous reaction to a vaccine. So do we have any more spur of the moment questions? You can put me on the spot and see how I do.
Yeah, Anna, go ahead.
So today, right before this call, I was talking to a nurse who was having an absolute meltdown because earlier today, she actually had to tell somebody who was experiencing, I don't remember what it was called. It was similar. It was kind of like it had something to do with the cardiovascular, but she basically had to tell him that there was no room in the hospital. And she, yeah. So everyday nurses are telling people that they're going to have to just die for something that's usually treatable. So I know that I'm so glad that the numbers are going down, but the wave after that is how it's affecting our hospitals. And he didn't have COVID, he had something else. And I think people forget that there's a whole wave effect. Like, I love the snow, but I'm not going to be skiing. You know what I mean? What's the situation with, I didn't ask her which hospital she was in, but I know that it was in this valley. What's the situation with the hospitals?
The hospitals are still quite full. I haven't heard too many stories of people being turned away. Most of the hospitals are able to shuffle patients and work with sister hospitals to get care for people, but it is definitely a concern. Though we've seen a decrease in cases in the last 2 weeks, we don't generally see that play out in the hospitals for 2 to 3 weeks after the cases drop. So we're hopeful this relative good news for case counts continues, and therefore hospital burden will also decrease in the next few weeks. But as of right now, it is still so important that we all protect ourselves by practicing social distancing and wearing face coverings so we can help ease the burden on our healthcare system. It's a definite concern. We consult with the hospitals regularly, along with the Utah Department of Health, so we can see if we need to make additional allowances for them, if we need to set up more or less filled hospitals. You may have heard about that in the news. We had some set up at one point earlier in the year in case they were necessary. Fortunately, they never were necessary, but we got close. And we don't want to be close again. And I'm hopeful that this decrease in cases recently will lead to us getting further away from being at that hospital capacity breaking point.
So are you guys on the edge of maybe having something like that? The feeling I got was that from talking with her was that that's starting a trend. That's, yeah.
I'm not aware of any hospitals that have asked for assistance with additional room or beds or triage ability or anything like that. I have not heard of any that need that. I know the University of Utah, University Healthcare and Intermountain Healthcare, they talk to our executive director every day, pretty much, along with the Utah Department of Health, and nothing has been said to me that they're moving in that direction. And I think the decreased case counts recently portends a good sign for that going forward.
Thank you.
Any other questions? Yeah, Nick.
Thanks for being here today, Mr. Rupp. Back in December, as far as the prioritizing the administration of the vaccines, in December, there was a category for critical infrastructure workers, beyond the ones you would normally think of, such as the EMTs and healthcare workers and that sort of thing, like transportation workers. I haven't seen that in the Utah priority list. Can you speak to that? Has it just been left out, or what was the thought process on that?
So I haven't seen that group in the current priority group list from the Utah Department of Health, from the governor's office at the state level. The last I asked about additional priority groups, I was told by the Utah Department of Health that they had discussed breaking it into multiple different priority groups, but determining who fit where and where they should land in the priority list was going to be so labor intensive, and there would be so much discussion about it that it was going to be more efficient to move entirely to an age-based system. Originally, they had all these groups in, they moved to all age-based, and then they added some priority group potential for people with underlying health conditions. And that's where we currently are. Age-based plus underlying health conditions, perhaps coming in March. They have not added any additional groups back in yet. And unfortunately, I don't have an inside loop with the Utah Department of Health or the governor's office to know what might be coming or what changes they might be discussing. I haven't heard anything else. The last I heard just yesterday is age-based plus potential underlying health conditions. But really, we get that information directly from the state, and we follow that executive order, those orders for how vaccines should be distributed. So I'm sorry, I don't have a really good answer for that.
Okay, just another quick question too. When will the appointments be available for March? Because I guess February is already booked.
February is currently booked. However, we do get cancellations every week, and we are occasionally pleasantly surprised by extra vaccine doses, whether they come from a healthcare system or a pharmacy that has used what they needed, and then they can turn the allocation back over to the state, who then distributes it to us local health departments, or we just have a few people cancel. We do have a few appointments every week, and we are inviting people off of our appointment notification list. It's on our website. It's only for 70 and older at this point, because that's all who is eligible for the vaccine. And in the last 2 weeks, we've invited 3,000 people to be vaccinated who could not originally get an appointment when they became available in February. So there are going to still be some appointments in February. To answer your question about March, I don't have a definitive date on when March scheduling will begin, because it's going to depend on vaccine dose availability. We're not going to make appointments available for vaccine that we're not certain we're going to have. That would be a terrible thing, to have appointments for vaccine and have people show up and we don't have the vaccine. So as soon as we know what our vaccine allocation will certainly be in March, that's when we're going to open the scheduling and have that many appointments available.
Great. Thanks.
I have a question.
Sure.
You were just saying for March, I'm in the 65 group. So how do we get notified, know where to go to sign up?
So when the state opens the next priority group, which we all expect will be 65 and older, possibly also with folks with underlying health conditions who are a little younger, we'll see. But when that happens, the state is going to announce it. It's going to be on every media channel. It'll be on social media. It will be on billboards. You currently probably see billboards from the state and other media outlets reporting about the 70 plus. So the same type of blitz of information will be available for 65 plus or the next priority group that is eligible. Here in Salt Lake County, we are going to have an improved process for signing up for vaccine. I know January 13th, when we opened appointments for 70 plus the following week, it was a very difficult day for the community and for us at the health department. The vendor that we had hired to assist us with that process did not come through as we had hoped. All of our systems we had in place worked as they were supposed to, but that piece of it with that vendor, the server crashed, and it was heartbreaking to our staff. We had dozens of people in tears because they couldn't help these seniors 70 plus because the server was down. So we have found some additional vendors to help us do that better, help us not have those problems, and make sure that the sign up process is much smoother than it was then.
Okay, anything else? I'm not sure I can see everybody because there are so many of us here tonight that I can't see them all on one screen. It's great.
I have a question, and thank you again. You're extremely welcome to be here and very well spoken. I have exceeded my expectations, so thank you again for coming. I wanted to ask those that have contracted COVID. I just wanted clarification. Once you contract it, how long is it before you can receive the vaccine?
So medically, the CDC says that after you're out of your isolation period, which is 10 days after your test date, or 10 days after you first had symptoms, as long as you're at least 24 hours after your fever breaks. So once you're out of that isolation period, you medically can safely be vaccinated. Now, Governor Cox has issued an executive order asking us to only vaccinate people who are more than 90 days past a COVID infection. So here in Utah, we would ask you to honor his request. And if you had COVID, don't get vaccinated until that 90 days past your infection has happened. And I can't really speak for the governor, but I believe he did that because people who've had COVID are going to have some antibodies protecting them for a period of time. We don't know what that period of time is, as I mentioned earlier, but we're pretty sure it's at least 90 days. We've done enough studies to know it's at least 90 days. So those individuals who've had COVID are likely, they're still protected for that 90 days. So I believe he thinks they don't need that vaccine, and that dose can go to someone who needs that protection more, which I think is a good plan for encouraging our vaccine doses to go further.
And my concern is that I haven't had it, and I've only known a few people that have had it, but not really close contact. But if you're protected for at least 90 days, they think 90 days, then wouldn't it make more sense to give the vaccine at a 60-day mark, because it takes the first dose and then another 2 weeks till after that, because then you're losing a complete immunity, and maybe it would function as a booster at that point. That was my thought.
That's a really good thought, and I haven't asked that question. I will check with Dr. Vitek, and I can send a message back to you, Randy. I know we have communicated, and you can share it with the group. But I may have misspoken when I said you have immunity, we think, for at least 90 days. Right. I believe that the experts of the Utah Department of Health who advised Governor Cox on that time frame, that I mean, Dr. Dunn, as I'm sure you know, is brilliant. Yeah. I'm sure that she considered that built-in time necessary for your body to build its response post-vaccine. So it's very likely that we're pretty certain immunity is conferred after having illness for 120 days. And so that's why they settled on the 90-day point.
I guess my final question would be, like, with that, would it make more sense once you've had COVID to give would you be able to just take one vaccine if you've already stimulated this antibody response?
You know, I've heard that question, and I have not seen a definitive answer. Okay. The CDC is still recommending 2 doses for people who have had COVID. The CDC is our everything when it comes to science behind the medicine. So we're going to recommend that once that 90-day period passes, that you should still have both.
Okay, thank you.
Okay, well, Nick, can I call you Nick?
Absolutely.
Okay, I want to thank you very, very much. This has been extremely informative. I'm sure that everybody appreciates your being here and sharing this information.
Well, thank you so much for having me.
Thank you. Okay, we'll now move along to our new police liaison, Bob Norgard, who tells me he doesn't particularly like titles. So I guess we can just call him Bob.
Please, thank you.
Go ahead.
Well, hello, everybody. My name is Bob Norgard. I'm the District 3 and 4 Community Liaison Officer. This is my third week in this assignment. So right now I'm just trying to learn everybody's name and relearn the area of downtown and Capitol Hill, which I have not worked in a very long time, probably in over 10 years. So one of the things I was hoping to get out of tonight's meeting was for you, the members of the community, to tell me your concerns and things that I can address myself.
Okay. I know that many of you have concerns. Don't be shy.
Okay, I'll start the conversation. Welcome aboard, Bob. Ken Kraus here, calling in from the east side of Capitol Hill, East Capitol Boulevard to be specific. I know there are quite a few folks on the call this evening who have as much and certainly more involvement with traffic and transportation issues on all of Capitol Hill and the surrounding neighborhoods. And I was delighted to hear earlier this evening from Chris Wharton and from others over the last 2 days about a renewed effort to develop some new ordinances at both the local and state level to deal with some of our most egregious traffic issues. On this side of the hill, and I'll be very brief because most people have heard of this several times, we have an extraordinary problem with speeding. We have the widest, longest, unimpeded stretch of downtown roadway that anybody knows about. And it's an extraordinary attraction, actually an attractive nuisance to scofflaws with big motors and tiny brains. I like to put it that way. I'm sure it will offend people when I say that, but that's how it is. And so as we move forward into the spring of 2021, still bedeviled by the pandemic, looking forward to the renewed efforts of the police department to spend a little more time on enforcement up in this neck of the woods, and also to be watchful for Brian Hutchinson, who is the head of our transportation committee of the CHNC, who is deeply involved in all traffic issues, virtually all of which involve the police department. So that's sort of a headline treatment. Glad you're on board with us and look forward to future visits.
Well, thank you. Nice to meet you. Anybody else?
Yes, I'm sure there are.
I'd like to know a little, I'm sorry, is anybody else?
No, go ahead.
I have 2 sons with special needs. They both have autism, and I know that that was a hot topic that a lot of people had talked about since the officer involved, or the child involved with the shooting. I know that they said that they were going to be receiving training. Can you give us any kind of, I guess, description of what that training entails?
Yes, it was a lot of just recognizing different behavior patterns, and both verbal and nonverbal things that these kids and adults suffer from. So it was a lot of just recognizing that and how to address it properly, as opposed to, yelling, hey, pay attention to me, pay attention to me. Really take into what's going on in people's behavior and really just how to address it properly. That makes sense?
You may have heard of have you heard of Project Lifesaver.org for at-risk individuals for flight risk, be it a cognitive disorder, Alzheimer's, or something to that effect?
I have not.
If you get an opportunity, projectlifesaver.org. When I was in Louisiana, I had both. My youngest son he doesn't have the tracker now. We were just able to remove it this year. We kind of celebrated it with his 11th birthday because we haven't had those issues for a good while now. But we had a lot of individuals with Alzheimer's and autism that would wander. And it's a radio frequency tracking device that the sheriff's office that we have there would actually monitor. All it was I actually have the equipment that I could demonstrate with you guys, but I'd love to see something like that. Although my child doesn't do it, there are still constantly in the news children or adults that are going missing here, and the conditions are much more extreme from where I came from in Louisiana. So I'd love to talk to you about that and see if that would be something that y'all would be interested in starting here to help with the individuals like that. This is the worst feeling in the world. And, the response time, when we place it on my son, I still had to be, hyper vigilant. I still had to look for my child, constantly. And, no eyes off at any point in time. You sleep with one eye open constantly. But knowing that I had a device to help track him, which was much more effective than just the GPS, because how many times have we ended up in a neighborhood, it says you've arrived and you're like nowhere near the subdivision you're supposed to be. But the law enforcement officers would triangulate with me in a search, or even have their own equipment to triangulate themselves with other departments even. So it was a wonderful piece of equipment. I'd love to see something like that started here to help with that, because that is a frequent issue. So that's pretty much from the special needs perspective, that's pretty much what I was wanting to talk to you about. So
no, that sounds great, and that's something I will definitely pass along and start a conversation.
Well, Bob, I was wondering if you would describe for everybody how the department has changed how it handles community liaison.
So the community liaison program was formerly known as the Community Intelligence Unit, which was a 7-officer squad and 1 sergeant. So the 7 officers were assigned to one of each of the council districts. With the staffing needed back in patrol, that squad and many other special squads were reduced in size to support the patrol function of the department. So it is essentially the same thing, except 2 of us are now covering 2 council districts and another officer is covering 3. So it's the same program, just less of us to shoulder the work.
I have a bit of concern with that, because I love Detective Gibbet, but when I would call, he would only have certain days in the office and he wouldn't be able to respond for quite a period of time in between. And it was kind of like, if you picked up the phone or were able to pick up the phone when he called back, you never really had the ability to get a hold of him directly. Mm-hmm. Now he was much better with emails, but I know you guys are overwhelmed. So I guess my concern is how much more access are we going to have if we have less officers?
You still have full access to me. I check my email constantly. I am constantly, ask my wife, I am always on my phone looking at my emails. So, with that being said, I'm glad you understand that less of us to do the same amount of work is very difficult. We're doing the absolute best we can. So, and
thank you for everything you do. We really do appreciate it.
You're welcome. We're all doing really. I'm out there quite frequently on the street addressing concerns that come in. So they're not being ignored. I get to them when I can, as fast as I can.
I have never felt that at all. Your officers, we have porch pirates. I've actually taken the Home Alone approach, where I start, putting dummy packages out that are tethered to furniture in the house. Right. So I'm sick. I haven't had any issues lately, guys. It worked. They all know me as the house not to come to. But we have constant theft, or had constant theft. And I had Smile You're on Camera posted in my windows. I have 12 cameras up. I watch them steal my stuff all the time. That's basically what I do. So mm-hmm. It's gotten better since I started doing dummy packages, because they figure it's not worth the effort. But it's very frustrating. And honestly, to have to call you guys for that, there's really not much you can do, because the response time to even if they were, if they were breaking in, it's a lot quicker, obviously, the response time. But for something like that, y'all are getting those calls along with the serious, severe calls all day long. So I don't envy you, but I think you're an honorable man for doing what you're doing. I really appreciate it.
Oh, thank you. Appreciate it.
I have a question. Can I go next?
Yes, please.
Okay, thanks. Hi, Bob. Thanks for being here.
Well, thank you.
One thing, we had, you look so familiar. Have you been to our meeting before?
No, this is the first one.
And you never pulled over people for speeding up and down I-15, did you?
Oh, geez, I haven't done that in a long time.
Well,
Wasn't
I-
me. Let's just clear the record. It wasn't me.
it was everybody else. But anyway, I really got to appreciate greatly, what's his name? Gibbik.
Gibbik?
Gibbik, I really appreciated his candor. And I mean, he didn't always give you the answers that you liked or that people liked, but yeah, he shot from the hip. Maybe that's not a good analogy, but so I'm excited and looking forward to getting to know you better. I think that, I live on Quint Street. We have on-street parking and, it's, car break-ins and, porch pirates and all that stuff. That kind of goes with the territory. Anyway, that's my little pet peeve. But you probably already know that. One thing that came to mind the other day, I don't get out of the house much. FYI to everybody, Costco delivers, and so does Smith's. So yeah, I don't even think I left the house in a couple of days. Nobody's getting COVID from me, but I did drive down to Costco a couple of days ago, and I was shocked to see police. I saw more police out there than I had seen in a long, long time. Saw, a cruiser here on the freeway. I saw a couple of cruisers coming back. I saw a couple of cruisers, and I'm just wondering, has anything changed in the past couple of days, or
With the amount of police in that
yeah,
area?
yeah.
Not that I'm aware of. That area, I worked that area in patrol prior to coming to this assignment. So that is a very busy area. There's a lot going on there. You have the Costco there, you have the Home Depot and the Lowe's. in
I'm
that
not
area.
talking about there though. I'm talking about here in this area.
Oh, I'm sorry. So in the Capitol Hill area?
Yeah, more or less.
So I would just maybe attribute that to maybe a few more officers in patrol now that can actually be out and be a presence.
Well, I don't know if everybody has the same reaction, but I was very happy to see it. So yeah, thank you.
I've been trying to be, for lack of a better term, a nuisance to the problem on 1st South and 300 East. Are you aware of that? There's that 7-Eleven right there on the northeast corner. Myself and our bike officers have been really trying to be a presence in that area because I've been told that's been a thorn in the community side for quite a long time. So I've reached out to the bike officers, I've reached out to the patrol sergeants to, when they have free time in between calls, if they could just kind of saturate that area, because that seems to be helping a lot. I mean, obviously police presence, people are less likely to do something illegal, right? So that could be why I'm not trying to take credit for that. But I would probably just chalk it up to that. There's just some more cops on the street now.
Well, I would like to emphasize what Ken Kraus said a little while ago. Our whole neighborhood has terrible traffic problems, and they're various kinds. He mentioned the speeding and the loud modified mufflers over on the east side of the hill. On the west side of the hill, we have a lot of cut-through commuter traffic, people running stop signs, a lot of near misses and sometimes not misses between cars and pedestrians because of that. Our streets, as you know, are very narrow. They're used to shortcut people on their way from I-15 to work either at the Capitol or downtown or at the university. So at rush hours, we have way more traffic than these streets were ever anticipated to hold. And people who don't live here and are in a hurry either to get to work or to get home. And so we have a lot of traffic infractions. I think when Ken mentions, enforcement, it's all of these issues. Ultimately, it's fine to have a stop sign, but if people think that they can run it with impunity, it might as well not be there. So I think you'll hear a lot of requests for increased traffic enforcement from us.
I am taking notes and I have already jotted that down. I will certainly
Okay.
pass that along. as
Hey,
well.
David, can I ask a question along those lines,
Sure,
if you
Jeremy.
don't mind?
No, go ahead.
And so, Bob, thank you so much for being here with us. And I know when we have really emergencies here I live in Marmalade, we've had very good police response. Just this morning, my neighbor reported a burglary, and I think we had officers here within 4 minutes of it happening. And there were 3 officers. It was handled very, very well. Can you give us some background information on, though, we deal with gravel trucks that come through our neighborhood at enormous speeds, 55 miles an hour. And we're talking about 50-ton gravel trucks that are coming down 300 West. And everything's been changing so rapidly with the police department. Can you give us some insight into, is there traffic enforcement? We'd previously been told that that was kind of on the back burner because y'all were so busy dealing with priority 1 calls. Is there any traffic enforcement going on? And is there any potential for that to change in the coming months to where we may be able to get a few officers to come to our neighborhood and maybe cite or at least warn these truck drivers that are violating the law?
So I can't speak to why, if there was a decrease of enforcement. Generally our motor officers handle that, and they have, they do enforcement and other things that I don't even know about. One of the big problems with proactive police work since COVID was just that, it was COVID. So the department kind of put some restrictions on us as far as doing that. So that may have been an effect of why you saw a decrease in enforcement.
Bob, could I? Have a
Thank you.
question?
Thank you.
Thanks.
Sure.
Brian, go ahead.
Yeah, thanks. Yeah. So I'm the chair of the Transportation Committee, and we have been working with Captain Van Dongen and others with the city. We want to actually approach this through a data-driven strategy. We've been working on this for quite some time. Maybe you can join our Transportation Committee meetings. We have next Thursday at 4 o'clock. I don't know if you
just got
have
invited
time
to another
do
meeting.
that, but we can bring you up to speed on the engineering that's going on in our neighborhood and the strategies. So it's not just poking at it and showing up and going away, and then the mice come back out. So it's a little more strategic if you can join us.
Absolutely. Is my email attached to this invite?
I have it, Bob. I can send it around.
Sure.
I sent you mine. Maybe just get with me and I'll give you a link to our Zoom meeting.
Sure. Yeah, just
Okay,
send me
great,
the meeting
thanks.
and I'll be there.
I have a question.
Yeah, Bob.
I don't know if this is even your department, but one example is on State Street and 400 South. If you're headed south and you're making a left-hand turn, you get a yellow light, but it never turns green. So the only way you get through that intersection and many others that you're making a left-hand turn is you're running a red light, because I've watched, and I don't know if that's your department or if that's through transportation and roads and stuff, why they don't implement more turn signals or turns, whatever.
Yes, I have fallen victim to that myself many times, and that is not the police department function. That would be streets, I believe. Brian?
Yeah, it's transportation that we
It's
have to deal with there.
transportation.
Yeah.
Right.
All right, I have a question for Bob.
Go ahead.
Sure.
How can the community better assist the department, the police department, in their function? What things should we report? When do we know we're just reporting too much and you can't deal with that and it doesn't help? Do you have any guidance on how we can make your job more effective and easier?
I would say be good witnesses. If things are going on in your community, take note of it. Everybody nowadays has a cell phone or some type of recording device. So any things like that we could get really benefits our investigations. As far as reporting too much, we don't ever want the community to think that they are reporting too much and they can't report something because they think it might be petty. Somebody Somebody messaged me right at the beginning of this meeting. Oh, it was you. Yeah. So no, don't think anything is petty. I don't know if you saw my response. One thing that is frustrating for not only the victim, but us as well, is if we don't have any suspect information or any, like I said, video surveillance or anything like that, those cases unfortunately go nowhere because we have nothing to follow up on. But that shouldn't deter you from reporting if you've been the victim of a crime.
Okay. Anything else for Bob?
You know, hi, it's Jeff Carlton. My wife and I own Mountain West Hard Cider. We're 4 North and 4 West. Just a quick note that we've had catalytic converters stolen twice off of our truck. The first time it was $7,000 of damage. Most recently, it was $4,000 of damage. Week before last, we had half a dozen propane tanks stolen from our side lot. And we've filed police reports. It's just an FYI. I understand that petty crime's up across the city, but just to let you know kind of what's going on in the neighborhood. And we've not had that problem before. So that's been in the last, 12, 18 months.
And I'm sorry, where was that at again?
4 West and 4 North.
Okay. And what is the business called?
Mountain West Hard Cider. And thanks, Bob. Again, we're all dealing with this stuff during COVID, so we'll deal with it. But I just wanted to let you know there's some activity in the area.
I will get out there and take a look, see what I see.
Thanks so much.
You're welcome.
Same thing happened to a friend of mine just next to the Capitol. He had parked his truck middle of the day. Someone took him, 10 minutes to crawl under there and cut the catalytic converter off and be gone.
Yeah.
Yeah, Randy? Yeah.
Yes, as I said, I have multiple cameras in my house. Now, I had turned those over when I've had theft incidences, and y'all have done wonderfully with those. I guess my other question would be, where we're talking about speeding, I have, you can see people almost get run over in the crosswalks. You can see people, I live Fern, right where Northwell comes into 200 West, and Fern's on the other side of it. I don't know if you know that intersection, but it's just before Warm Springs Park. As you pass, you go past the schools and all that, people are going 50 miles an hour because there's really no stop sign, past 400 or 500 right there. And they just gun it all the way to dump into 300. I mean, I wouldn't be surprised if they didn't even stop there. So they're not only speeding, but they're not paying any attention to the 2 crosswalks in between there, one of which is in front of a park and the other is at that intersection where Northwell and 200 are. I have video after video. What can I do anything with that? I mean, is there anything that y'all can pursue with that if we have repeat offenders? Most of these are daily, you'll see Monday through Friday doing the same behavior. It doesn't matter how many times I come out, and try to intervene. It doesn't matter if I'm holding a flag, if my kids have flashers, if it's nighttime and we have, the illuminated, I had one of my kids on a hoverboard the other day and I was trying I was walking with him and we were almost hit. So, and I had it on video. So it's terrifying. Can I do anything to show you that same car? I can't clearly see the plates, but I mean, I could set up another camera to where I could if I need to, but is there anything I can do in that intersection if I keep saying, or if I keep seeing the same vehicle over and over again?
Well, yes. What would be great if you could get that license plate, then you could file a reckless driving report.
Okay.
So that would be a good start.
Okay, but as far as ones where I don't, the previous ones and stuff, there's really not much you could do other than it's just too much. Y'all have a lot on you. I just was wondering if that would be something, or if y'all just want to see how bad the traffic is. I mean, yeah. I've got the perfect point to see speeders and to see, because I have a crosswalk right in front of, my house. So
sure. I mean, I'm sure you can understand, it's very difficult to get a report of a blue Lexus traveling northbound.
Correct. That's what I said.
To find who it is. So yeah, if you can safely get license plates, that would help.
Okay. Well, thank you very much for everything again.
Okay. Anyone else have a question for Bob? Well, then thanks and welcome, Bob. We look forward to having you as a regular participant in these meetings. And we look forward to working with you.
Likewise, thank you.
Thanks very much. Okay, we have a few minutes left. Brian Hutchinson, the chair of the Transportation Committee, would like to give you a brief update on what is going on with the proposed bus rapid transit alignment that will go through our neighborhood. Brian?
Hi there. I thank you very much, Dave. Yeah, it's just a quick update. I shared at the top of the chat. People can go to that, find a link to the map of the traffic calming plan for the neighborhood. A lot of engineering. We're working with UDOT and Salt Lake Transportation, and also with the City Council, Chris Warden and the mayor on solutions. And in there on that map, let me see if I can get this. See if I have. Actually, I don't know if I can do this. On the map shows highlights a route that we are proposing, and so for the BRT line, which is a connector, community connector between Davis County and Salt Lake, and Senator Weiler is on the call. He knows about that. He can speak to that as well. It's a big deal. It could amount to between 2,000 and 4,000 displacement of 2,000 to 4,000 cars a day on the work week. Anyway, currently we're still talking about alignments. One thing I wanted to share, and I'm actually recruiting tonight, people to support our effort. We're going to do a video log, a traffic video log at the main intersections of 4th West and 6th North, 3rd West and 6th North, and 10th North and 3rd West. And just to get a real granular handle on the traffic, we will isolate, we'll determine what vehicle type, speeds, quantities, turning frequency, all sorts of things. So if you are interested in doing that, please give me, go to the chat right now, or you can go to our site, CHNC-SLC.org, and you'll find a way to communicate your support for this effort. Our goal right now is to, on this Davis to Salt Lake BRT line, which is a bit down the road, but we're still in the planning phase, is to clarify all the issues and also identify the effect of route assignments on the disturbance, potential disturbance, but also basically on the efficiency of the entire system. So take a look at that map. You can always go to CHNC-SLC.org and look under transportation, and we have the maps and other issues on our website, which Anna has been working really hard on. Any questions?
I see at least one thumb up. Are there any questions for Brian? I guess not.
I have one. I'm sure I have one.
Sorry.
No, go ahead, Randall. I mean, Roger.
Brian, my concern in the future will be the increased traffic through Marmalade and the west side of Capitol Hill when the new apartment complex next to the library is filled up. I can just imagine that half of the people there are going to want to drive right through our neighborhood to get downtown or to the university or wherever else they're going. And that looks like that place will hold a lot of cars.
Yeah, that's definitely the case. And we're working with engineers at Salt Lake Transportation. Kyle Cook has been working with us closely on our traffic calming plan. And we have a CIP application in, and he's just ushering that through. But that's going to come in line within a year and going to add 300 to 500 cars. And that's part of the impetus for this traffic calming, the urgency of getting some engineering in place. So we don't rely on, Randy jumping out there out in the middle of the street with flags or with a policeman. Enforcement, we want to actually engineer it so that people understand, what the safe speeds are. And good point. And it's not just that. We have many other apartment developments in the works, and the place is blowing up. The owner of Mountain West Cideries on this call, and we've been working with the mayor and with business owners on just to better understand the pressures that exist and also get a better handle on the dangers and just the behavior of the traffic and what things can be done to make it more efficient, safer, quieter, and more compatible with a walkable neighborhood.
If I could add something about the bus rapid transit, Roger.
Yeah.
We are fighting very hard to have the bus rapid transit run down 3rd West and then transit over to 4th West, where it connects to the station downtown. And one of the reasons that we're doing that is because there will be 2 stops in the area between the south end of Warm Springs Park and perhaps 4th South that will allow people from the neighborhood to jump on the bus rapid transit and be downtown in 2 minutes and be at the university perhaps in 20. And so there will be a good alternative to driving to work if the bus rapid transit is convenient, especially to that development that you were referring to. And if we get our way and the thing runs down 3rd West, it will be there. Now, it's not going to be there real soon, but it will eventually be there.
Yeah, I should point out there's a survey that was submitted a little prematurely, and the director of this project did concede that it probably was ill-timed, and it's kind of incomplete as well. And what they've done is, unfortunately, they've presented to the general public two choices, and they've ignored they failed to include the preferred route that we're advocating. Right now, we'd rather replace the industrial traffic that's on 300 West with buses. And we don't want buses going on 400 West, which is going to be a long-term industrial route. I'm talking about north of 6 North. So our position is that we certainly don't want to send buses between 10th North and 6th North on 4th West, because it's going to dump trucks onto 300 West, and we have a crosswalk coming there, and it's turning into a more commuter oriented and neighbor sensitive corridor. And we're working with UDOT to lower the speeds and just make it more sensible. So should you be given the choice at this point, I would say, yeah, go to the 300 route and certainly not the 400 route. Jeff Carlton's on the call. He might be able to tell you how it would affect his business. So anyway.
David, can I present before we log off, please? I've been waiting.
Yes.
Thank you.
Ava, go ahead.
Apologies, everyone. I want to make sure I capture this. I want to go over this quickly so I don't keep you waiting, but tomorrow is the first listening session for the Racial Equity and Policing Commission.
I'm sorry, I'm not sure everybody knows who you are, Ava.
No problem. Thank you, David, for the reminder. I'm Ava Lopez. I'm the community liaison for the mayor's office, representing districts 3 and 4. This will be my 2nd year now at the city, so congrats on a good wrap up. Some of you may have seen the State of the City address, and I'll talk a little bit about that. But I wanted to get back into this. So this is important. So again, it's the Racial Equity and Policing Commission. They have their listening session tomorrow, starting at 6. So if you go on to the link I put there, there's instructions on how to register, how to participate. You can call in, you can join virtually, you can also text in. And this is a critical participation that we're asking from the public, as this commission is really deep diving into policy and looking at potential reforms that we can make. And helping build a safe and efficient and equitable police department. And I've also attached the link here for the Salt Lake City report card. And what we've done, it's the first time ever that Salt Lake City has an annual report where we look at both our successes, our progresses, and things that have been put on hold. So if you go through this, you know, you may see there's a lot of economic development and movement in Tech Lake City, but where we've seen progress or where we've seen some stops and holds may be related to housing. A lot of this, as you know, we don't like to necessarily say the pandemic was the hold, but definitely we saw some delays in the past year that now you'll see progress or being reprioritized in this year. And we're happy to get back to work and continuing these same efforts. If you were with me last year, I just want to recite again what the mayor's pillars are. When I first presented to you all back in January, I recited the mayor's vision, and I'll just recite them quickly. It's to harness the growth of the city, to be equitable, to serve our city and all the people of our city in a way that serves and brings justice to all communities. And the final one being to be good stewards of our environment. So again, a lot of what you'll see on the report card is to reprioritize if somehow we have been putting priority to another type of response, to reprioritizing those pillars and making sure that our administration is able to make changes in those directions there. And then, of course, last night was the State of the City address where Mayor went over not just the previous year, but what to expect in 2021. And I've put the link there. If you haven't watched it, I recommend it. It's a very powerful State of the City address, I would say, where Mayor wasn't afraid at all to talk about some issues that our city sees and to also look at the opportunities available for us. One of those being homelessness. I think there's a lot of questions as to what is the future of it in our city, and with that, you know, we're looking at efficiencies and not just response, but also in our partnerships. So with that, I wanted to tangent. There is an encampment called Camp Last Hope that I've received some calls from the Capitol area about wanting information. So on February 3rd, that camp, which is currently the largest encampment in the city, will be abated. And right now what is happening is partners are going in and offering them services and housing where they need it. So for some of them, it might be shelter situations, it might be motels, but our priority is to get these individuals into safer housing, into healthier situations, so that they're not on the cold in the environment where it's colder and they're exposed to the elements. And of course, I also want to mention, Councilmember may have mentioned this earlier, but there is a joint commitment to electrify our transportation. So to look for clean energies, and that is between the mayor and the council's office. And of course, I want to reiterate, there is still $1 million in rental assistance available to Salt Lake City residents, if you know of anyone. And last night, Mayor did announce in the State of the City address that they have come up with $6 million more from federal help, I believe it was, that came to be able to help Salt Lakers assist with rent. And if there's any other questions, happy to take it. Thank you to Detective Norgard. He's been a great energy boost, I will say, and productivity in a lot of different issues, specifically with our noise ordinance and as well as traffic calming issues. So I'm really excited to work with him and continue pushing that as we look and enter our second year as an administration.
Okay, any quick questions for Ava? We're a little tiny bit over time, but. Okay. Oh, Brian finally figured out how to share his screen. Okay. Brian, you want to narrate for us a little bit what we're looking at?
Oh, hello. Yeah, sorry. Coming from the north, Davis County, Dogleg at Warm Springs Park, go straight down 3rd West, go either at the library, take a Ralph, and go to 4th West, and this is where Mount West Cidery is in Red Rock, and then here's the new transit center. The old route, locally preferred route, as they call it, took a right here at 10th North and went down 4th West. this is very problematic right here. Heavy industrial traffic ripping through here and turning left here, and we're going to add buses to that. And so that's why we're advocating. And the current route that you'll see in the survey goes down here to 3rd North and West. Well, we feel that is better at least than going down 4th West, which is just going to create a can of worms and dangerous issues. So anyway, that's it. If anybody has any questions. But this is on our website. This is at chnc-slc.org under transportation.
Okay.
Okay.
Well, I think that pretty much wraps it up. I will entertain a motion to adjourn. Anybody care to move to adjourn? Brian, anybody care to second? Ken? Okay. Any further discussion? All in favor? Any opposed? All right. Thank you very much, everybody. This has been, I think, a very informative and productive meeting. Look forward to seeing you again soon.